This major recruitment by the Port Moresby General Hospital is timely as the hospital prepares to reopen its doors to the general public next week. CEO of Port Moresby General Hospital, Dr. Paki Molumi, said the recruitment is important so that the hospital does not neglect its normal duties. Strict measures, of course, will be maintained, such as wearing a face mask.
When we had the first case in the ward and then other cases that were detected at the hospital, many, they were scared because of the information that's floating around, and many of our staff were isolated or quarantined. But now, with this recruitment of 88 nurses, another 6 doctors now, but we'll have another 4 that do 10 doctors, and 1 X-ray technician, we're able to fill in those gaps, and we want to return back to normal. So starting next week, I want to encourage all the patients to come and get their treatment. Our PMGH is open. We are here to serve you. So we have done our necessary infection control measures to clean up the hospital. So the hospital is open.
Acting Director Medical Services, Dr. Connie Sobi, while welcoming the new staff, also acknowledged the commitment and hard work displayed by existing staff after the 4 lab technicians tested positive for COVID-19 and a few other hospital staff.
As human beings, with the lack of reporting of cases over 2 months between May or April, end of April and May and early June, there was somewhat drop in our guard. So just over 3 weeks ago, with the identification of this case plus 1 case from a deceased person in the morgue, pushed us to do more testing. And since then, there have been more positive cases identified. So the onus is on us. I want to thank the staff that have continued to support, and we really welcome those of us who have joined, those of you who have joined us this week.
Head of Internal Medicine, Professor Seisi Kevau, reminded the new recruits of the huge responsibility they are signing up to at PNG's National Referral Hospital. He said the hospital has come a long way since 1967 when he started work. Professor Seisi Kevau also challenged the hospital management to increase the number of patient admissions. Since the hospital went into lockdown 2 weeks ago, the number of admissions has dropped, prompting the professor's concern.
Our role is to make sure that as from today, in the presence of a good minister, and it's already been alluded to by our CEO, we need those patients that the Port Moresby General Hospital was blessed to look after. TB, leprosy, pneumonia, lifestyle disease, all of those patients have to come back. We've got to go back to 15, 18 admissions per day, not 1 or not 2. Because there is nowhere else they can go. The other places that they can go to is beyond their affordability.
Not many people would do what you're doing today, volunteering to take on the front lines. A lot of people would stand at the back and criticize, use Facebook, social media, and those type of things to prevent people from doing the right thing. You are doing the right thing. Our country, a Christian country, deserves people like you. And on behalf of our Prime Minister, the Honourable James Marape, our Deputy Prime Minister, our government, our appreciation and thanks to you all.
Meanwhile, at the hospital, there were 5 COVID-19 admissions. From the 5, 2 have passed away.
The challenges are huge. We have set up our isolation facility, and so it's almost a week now since that isolation facility has been operational as an intensive care facility for severe COVID-19 patients. We have had 5 admissions to that facility since then, with 3 cases that are intensive patients requiring intubation and ventilation. 2 of those patients have since passed on. And I want to take this opportunity to extend our sincere condolences to the families of these two deceased. We have one patient who is still on the ventilator at this point in time, and we have discharged one patient after 10 days of observation, and patient has been asymptomatic and complying really well. So we have discharged them to the community. At the moment, we have 2 patients that are still in the ward, and hopefully we can discharge them after the required time.
The hospital, despite a little setback, is now prepared to open its doors to normal services. Shamin Poreambeb, National EMTV News.